Well, good morning and welcome to Saturday Morning Live. I am Becky Taylor, and it is so great to be back in the studio with you again this morning. I just welcome you to come. You might want to notify some of your friends that you know may have some neurological spine problems. If you know someone that regularly goes to chiropractic care and just seems to be a chronic issue in their life, I want you to get them on this call this morning, or go back and find the podcast, or find me on Facebook. If you were to hashtag I am Becky under the search bar on Facebook, you're going to see me streaming live right now on Facebook with my special guest for the second time. This is 2 out of 3 series that, and I hope more. I hope it's not just 3, but of series here in the studio. And I am in the studio with Dr. Sarah Kotlerman, and she is the health director, the chiropractor, the doctor. And you saw my introduction yesterday. This woman is the smartest person in the room, I'm not gonna lie. And she is also my doctor. I trust her with my life, my spine, my functional medicine, and I am so proud and honored to have her in the studio this morning. And you know how you love to spend your evenings sometimes just getting on and watching your Netflix series, whatever it might be, that you're just addicted to the series and you're just going to binge watch all night long. Well, Dr. Kotlerman, I don't even know if she has a TV, because her binge night is reading medical studies from around the world about spinal care. And she sent me a couple, and I'm kind of a geek about this stuff. So I'm deviating from, like, last month when my husband Bob, my other very favorite co-host, was here, and we talk a lot of things political and what's going on, and try to keep you informed and relate with you about all the things going on and give you a perspective about it. But the other side of being a part of this movement of what's happening in our nation right now, MAHA, is another big one, making America healthy again. And Dr. Kotlerman is all about that. She is Body Heal Thyself. Stories that I have heard that come out of her clinic will literally make you drop your head and just weep, because of how she and her team are activating the body to heal itself, and knowing that the health, the life of the body is in your spine. And so this morning, I want to just let her take off, because she has so much value to bring, and I'm going to interact with her because I get kind of excited about this topic as well. And she knows I'm a geek about it, so I'm blessed to be able to get some of the updated articles and some of the stories. And I hope you interweave with some of these great articles that you are going to talk about today, and one specific today, some of the stories, just because that is the impact on lives, from little infants to 90-some-year-old people. There's no, they don't have any age specific, because the body can heal itself at any time. As long as you're alive, you can have the ability to repair your own self if you have the proper tools and you do the proper things, nutrition, etc. So Dr. K, as I'm going to refer to her, Dr. Kotlerman, throughout the rest of this show now, talk to us about cervical care. Let's just kind of dive in, because not only are you passionate about it, you've made me passionate about it. And I'll tell you what, my husband is the biggest skeptic ever. And when I brought him in to have my first x-ray screening with you, and he's like, I'm a hard sell, he just didn't know if I wanted to be doing all this chiropractic stuff, let alone all the other things that were involved. He walked out of that office saying, sign me up. I'm doing it too. I want an x-ray. I'm on this. So this is how well Dr. K can take something extremely complicated that would make other people's heads spin and make it something that you can really understand, and then understand why you, if you're listening to me, if you're watching me, you need this too. Dr. K, welcome. I'm so honored to have you here today.
I don't know if I can live up to that introduction. So, cervical spines. If you're not familiar with the language cervical, that means your neck. In your neck, there are 7 bones. Medically, we refer to them as vertebrae. And I think most people understand that they have a spine, Where it gets lost in translation is that there are major nerves inside of your spine and major blood vessels inside of your spine. And another study that I will send you after we get off the radio show today, which you will love, from 2019 was done at Harvard, and they actually looked at reassessing the primary indicator of whether or not a person would get dementia. Right? Dementia is a big talking point. It should be a big talking point. How sad to work your whole life, contribute to society, and then your retirement years not even be able to enjoy them because your brain is breaking down in a way that you are not able to remember who you are, who your family members are, what you like. So Harvard, 2019, they looked. Now, prior to 2019, the biggest indicator that was kind of generally accepted in the medical community around dementia was a loss of smell. If you started to lose your sense of smell, that indicated certain parts of your brain were likely shrinking and breaking down. So a lot of neurologists were using different types of scent-based testing. In 2019, that changed. In 2019, the primary indicator for dementia became blood flow. If we look at blood flow to the brain, the primary area is coming out of C1, C2, and C3 of the spine. So if there is a misalignment, if those joints are abnormal, if they're away from where they're supposed to be, you're going to take those blood vessels that are inside the spine and you are going to stretch them. When you stretch them, the circumference inside becomes smaller. And we've developed CT technology to prove this, a specialized CT technology to look at the upper cervical spine and see how big the circumference is. And then we drop the ball. We don't tell people the truth that if they actually put the work and the effort into bringing their spine back into normal alignment, the circumference of those arteries would come back if the arteries were still normal tissue. Now the challenge comes in when they become stenotic. So sometimes when I talk with medical doctors.
What's that word?
Stenotic. Stenotic means full of calcium. And we will actually
okay.
see this on an x-ray. And we see it ridiculously commonly. Okay? We do not image enough. And if you do not image, you do not see. At Averio, we're very, very focused on a test, not guess model, because if you can actually see what's going on, then you can create a plan to actually address the issues versus guessing off of how somebody feels on that particular day.
So we'll end there. Test, not guess. Test, not guess. And I hear that continually. When I'm at Averio and go through what it's called the week of care or a day of care, they are educators. I spend 2 hours to 2.5 hours during each given day in education classes, which is absolutely key. With that, we're going to go for our first break, and we'll continue this conversation when we come back.
Spring is here, and now's the perfect time to
Back down. Welcome, everybody. Okay, I'm talking to you guys too. I turned you on a little bit right at the beginning, but you guys share this out for people that you think that you know. And you guys, if you know a chiropractor, if you know a medical professional, a functional medical professional, that you want to hear this kind of information, share it to your wall, tag them, or just tag them in the comments. And by the way, I will be dropping any of these studies that you want, all the studies that she has sent me. I'll drop them in the comments so you guys can go click on them and open them up and read them, or I'll send them to you privately if you private message me as well, because there's just so much good stuff here. So if this is something that you know that you might have need of, and I will guarantee you, and I know Dr. K can attest to it because she works very closely with Children's Health Defense. Guess who started that? RFK Jr., right? And he's now got a very much bigger job. But Averio Health Institute and Dr. K has been very connected to them for several years now. And now she's actually training and doing special programs, as she was telling me off air, right now, like series she's putting together for them. So you guys, she's not just a little local chiropractor, you guys, she's very national, and she is ready to train, and she is training nationally right now. So, but thank you, Jesus, for people in my own backyard. That's where she's at. So I'm very, very blessed. So anyway, what my point was, share this to your wall, tag some people that you might know. If you have a medical professional, chiropractor, functional medicine person, you might want them to be listening to this, because you can actually help them get involved as well, perhaps. Okay. I like this thumb thing that is on you. Okay, back to the show. So I'll be talking to both of you now. All right, we are back Saturday morning live. My name is Becky Taylor. I am Becky on Facebook. If you hashtag me, you can find me and follow me there on Facebook. It's kind of fun to see the back, what it looks like in the studio. So if you have a Facebook, I'm streaming live on my wall right now, and Dr. Sarah Kotlerman of Averio Health Institute is with me in the studio, and we just broke, the last thing we were talking about is test, not guess. It's one thing I think of, if I would say there is a huge pet peeve or distrust in the medical community today, and any just medical doctor I'm sorry, but you did it to yourselves out there, doctors. Some of you, not all of you, I don't put you all in the same bath, but they just spin the dial when you go in, and they are medical practitioners. They practice. Yeah. And I don't care for the guessing part. I do appreciate that. When I went into your office and had that consultation with you, you said we need to just look at this. We could talk about it, talk about what my concerns were, but straight into the x-ray, and it was right there in black and white what was wrong with my spine.
There's a critical reason for this, and it's a reason we don't talk enough about, and that's the fact that a very, very small amount of your nervous system can actually send and transmit pain signals. So the medical model has taught people to pay attention to when their body is in pain. And there's nothing wrong with that. It's just telling too small of a story. So if we look at the body, the only tissue in the body that can send and receive pain signals are your nerve cells. Your muscle cells do not sense and send pain cells. Your bone cells don't. Your joint cells don't. Your heart cells don't. Your organ cells don't. It's just nerves. So when you have pain in a certain part of your body, it's because the nerves in that part of your body are inflamed, and they are sending a signal to your brain. If that signal does not get to your brain, you won't experience pain, which is where over-the-counter NSAIDs come in play. They block that neurological signal. Your body's still experiencing pain, but it just can't sense it in the brain. So why we put such a huge emphasis on objective testing is because a patient may come through the door and go, I feel kind of okay, I don't really have any pain, so I don't need to look at my spine. They've missed the ocean of opportunity there, because only 8 to 9% of the nerves in your body, the nerves going through your spine, transmit pain signals, which means 91 to 92% of those nerves are doing things like controlling your blood pressure and controlling how you digest and absorb nutrients, controlling your ability to be fertile, controlling your ability to regenerate tissues, controlling all these other things that you don't think about, that you take for granted until there's a disease on the table. So the spine, when we look at the spine, and when we talk about the spine to nerve connection, this opportunity is not just for people who have back pain. Back pain is where your body's trying to give you a little kick in the pants, going, hey, something's really wrong here. But most of my patients don't have pain. Most of my patients have something abnormal, inflammatory going on, and we look at the spine because that's a critical piece to looking at how healthy your central nervous system is. 2 parts of the central nervous system are located inside the spine. We do not talk about this enough. The lower part of the brainstem is located in C1, and then from C2 to about L1, L2 is the rest of the spinal cord. So this leads into another fascinating point.
Yes, I can't wait. Let's go into that study, huh?
So the study on C1 is groundbreaking.
Get ready, guys.
And you really have to just read the first. That's why I sent you the actual studies, because everyone should read the first couple of paragraphs. This is a medical study. It's not a study done by chiropractors. It's a study that was done by medical doctors and PhDs and neuroscientists. But they go into C1, this part of the nervous system that's inside of the first bone of the spine, And they go, this is your body's EMT. It does all of the emergency functions. It controls your heart rate, your breathing, your immune response. Hello, where was that over the last 5 years?
Right.
Who had the guts and the integrity to stand up in front of the American people and go, oh, by the way, the part of your nervous system that controls how you respond to infectious disease is located at C1. Everybody go and make sure that that area of your body is in normal alignment. I didn't hear that. Did you hear that?
Hello. I mean, yeah. No, of course we didn't hear that.
Yeah. Unfortunately, putting anything over your face doesn't change the alignment of C1 or the function of the nerves in that area.
Right.
And this is a study that was published in 2013, so it's not like this was just last year. This has been the foundation of our understanding of the body for a long time. Further looking into that study, in the first 2 paragraphs, they put all the functions that they have conclusively proved come from the C1 nerves, including your appetite, how much food you want to eat. Okay, so when we talk about the whole G1LP and all this stuff, that's having an effect on the nervous system. Where are those nerves coming through? C1. They're coming through C1. Okay, fascinating. If you actually took 10 seconds to read that, you probably would want to have x-rays to see how your C1 was sitting in normal alignment.
So let's talk about the x-ray part of it, because if you were to go into a chiropractic office, you know, in your knowledge, you talk with chiropractors all over the nation. Is it a standard practice that before I'm going to put you on the table and start the, you know, and I say that because, you know, when I had gone there before, and this was post I snapped my bone, my C2 in half, you know, in 2006, and then later on, I would go to these chiropractic offices and they'd take my neck and do the quick jerk thing. And then I would be traumatized. I'd have a real PTSD response to it. But they didn't go x-ray my neck to find out first. They just go in and start cracking. How important is it that if you go to a chiropractic office, that they, before they start just pressing on your back, doing the body twist, that they find out what they're working with first?
I think it is absolutely critical that there's some sort of imaging. Now, there are more imaging opportunities than just x-rays. You have chiropractors who are using pre and post thermography, and they can get some really great objectives off of that. You have chiropractors who are using pre and post MRI. Some of the most impactful MRI studies have actually been done by chiropractors, and they get absolutely no press anywhere. But there is conclusive proof that one chiropractic adjustment changes cerebral spinal fluid flow around the brainstem off of pre and post MRIs. The studies were done by a Dr. Scott Rosa, and it's big in literature, it's big in upper level neurology textbooks, and the general public goes around with no idea that that's happening. I think it's critical that x-rays are taken. I don't treat anybody without being able to see what I'm treating. So if I thought that a person didn't need x-rays, then I would think that that person didn't need chiropractic care. So they either are bringing x-rays from another provider or we're taking x-rays. But there's actually a more important piece than just taking the x-rays, and that's the piece of analyzing those x-rays. X-rays, you have differences on the nervous system when there's challenges in the spine that are millimeters. We're talking millimeters. The most critical one when we talk about spine and nerve is something called ligament instability. So if you have spinal ligament instability, that can be a difference of 3.5 millimeters. I mean, we're talking super tiny, or a couple of degrees on a disc. But spinal ligament instability means that there's something wrong with the soft tissue of the spine. Now here's where it gets interesting. Since the 1960s, with a diagnosis of spinal ligament instability, the American Medical Association has given that diagnosis an impairment rating. The impairment rating of just one area of spinal ligament instability is a 25 to 28% whole body impairment.
Wow. And I've got like 4 instabilities in my neck.
It's incredibly common because we're not taking x-rays and we are not analyzing them. So people are walking around with their health constantly on a downhill slope, getting slower and slower. And along the way, we give them disease labels.
Yes.
But that isn't what's causing. The diseases aren't the cause. You actually have this slow breakdown of the nervous system because the spine is compromised. And this is what's being missed. We are missing the fact that when we talk about spinal health, we're talking about how your nervous system gets to function. And that's not medical neurology. I am not being a medical neurologist.
There's a difference between going to a neurologist and
Very
working
big
on spinal care. So
very, very big
so
difference.
separate the two. If you hear the words neurology, you can look at this. I'm literally covered in goosebumps right now because this is so chilling to hear this. We've got about 1 more minute. We got to go to a break again. Oh, I wish we didn't have breaks on this show, and I'm sorry that for you guys that are listening that we do. But it's chilling to think that we are letting our healthcare system guide us through misdiagnoses that could be perhaps solved by curing the neurological, the cervical
just objective
care.
testing. Open the door on objective testing. Make it a standard that doctors have to run objective testing.
And they don't know what that means, most of them. I'm sorry, but they don't. And with that, we're already up against our next break and at the bottom of the hour, and we'll come back. All right, so you guys can have the bonus. So if you guys have some questions here, you guys get a little bonus activity. And I saw a question here. Hi, Sister Amy, listening for the first time. So glad to have you listening. And Dave and Ellen, thank you guys. This is awesome. Paul, good to see you. Always. Good morning, sister. David, I think you had a question. Does Medicare cover that? You know, most of the time not. I know at Averio Health Institute, it's alternative stuff that Medicare doesn't like to recognize. I don't care. I go anyway because I'm worth it. My health is worth it. And you know, she's got an entire professional, large team, and she's continually educating more people with her health institute, Averio Health Institute. If you Google it, it'll pop right up. You can literally go for a deep dive into all what they do and the interviews that she's had with their website is absolutely loaded. So if you want more information, or if you want to get in and get a consultation with one of the health professionals there to kind of evaluate your own situation, I would get in there. And it takes a little bit of time to get in, even for a consultation, and then even longer. Perhaps if we have time, because there's so much other things I want to talk about, she'll explain what like a day of care means when it comes to going in. Like when I go through a day of care, which I do once a month, and then I go in about every 6 months for a week of care until my cervical instability and my is cured in my body. I probably go through and have 25 to 35 little micro adjustments a day for an entire week. And then I have about 3 hours, 2.5 hours of education within that day as well. Beautiful lunch and a dinner. So that she'll kind of talk about what that looks like if we have time. But I do have other things that we're going to be talking about. But anyway, I'm just kind of giving you guys a little bonus time because this is kind of our longer break. So anyway, it's not covered by insurances unless you have a private insurance. They are not.
Chiropractic care is covered by Medicare B. That's actually one of the kind of scary things that third party.
Can you guys hear that? Because we're kind of noisy back here. We're not going through, but we'll try. Say that again.
So Medicare B is covered. The chiropractic is covered in Medicare B, but one of the things that's getting lost and people don't even realize they're losing their benefits is when they buy supplemental insurance plans. Medicare B actually covers 100% of single chiropractic adjustments as long as there's some sort of symptomology going on. So if people knew this and they worked with a doctor that covered Medicare, they could get a tremendous amount of covered chiropractic care. The challenge is the insurance companies have been beaten up on chiropractors for about 30 years. So very few really quality, they're out there, but very few quality chiropractors still take some of these different types of government insurance because the reimbursement rate is like $23.
Oh boy.
I mean, seriously?
That's ridiculous. ridiculous.
We, on one hand, you have pediatricians making 100, 150,000 a year just by submitting vaccine records. They don't have to do anything. They just submit vaccine records showing that 63% of their population is vaccinated. And then on the other hand, you have doctors of chiropractic who actually have to go to school for more training than a medical doctor, and they only make $20 an adjustment. They can't stay in business.
Right.
So a lot of really high quality chiropractors have exited insurance because they couldn't keep the lights on.
That makes sense. So, Karen, is the Blair method?
Yeah, it's an excellent technique.
Okay.
What you need to do is make sure that you're getting appropriate pre and post assessments to show that you're going towards normal.
Okay. Good question, Karen. Hi, my friend, by the way. All right, we are back, and we're going to dive right back into our conversation. We were talking about the C1 and being the conduit for all the nervous system in the body. Let's go a little bit deeper into the weeds with that, because the communication system of our neurological cervical care, it filtrates the entire body. And I think I mentioned this last time you were on the show, but I'll go quickly, because when my husband Bob, hi Bob, by the way, he's watching, and he wanted to say hi to you, Dr. K, because he loves her so much too. But when he had his X-ray, and he has a pacemaker that was put in about 4 years ago, you actually were able to say, see that right there, that little spot, that goes directly to your heart. Mm-hmm. And most likely that is why your heart was not communicating effectively. And in fact, I appreciated that you even said that, you know, if we could catch these things before, mm-hmm. that you could, and you start adjusting that cervical spine, that would have remedied, that would have healed itself.
Correct.
Talk about that,
Yep.
that communication system, and how that to me was like, boom. I mean, my head just blew off going, what? A cervical care done in the proper way could have prevented a pacemaker? That's revolutionary. And that could lead us to all the other kinds of, a few other little stories that will tear on your heartstrings. So talk about that again, and just kind of weave that all together for us.
So we know, and we have known for a very long time, that certain spinal nerve roots go to certain organ tissues. So when we talk about the heart, we know it's coming off of the brainstem. So you have vagus nerves and brainstem communicating with the heart. But then we know spinal levels 4, C4, C5, C6, C7, T1, T2, T3, T4, T5. And for those of you who are not familiar with the spinal levels, that's the lower part of your neck and the upper part of your mid-back where your shoulders connect. Those spinal nerve roots they are communicating between the heart and the brain. Now, why so many? This is a question we get a lot. Why, Dr. Kotlerman, are there so many nerves going to the heart? Well, the heart's really critical. It needs to function for you all the time.
Right.
So there's a tremendous redundancy built in. Now, when you're a chiropractor who actually takes x-rays and analyzes them, when you see people who have heart problems, you will see that there's always spinal damage in multiple areas within that section that I just shared with you. It's not like you just have one area of the spine that becomes abnormal and then organs start to fail. But once you have 3 or 4 or 5 areas that are becoming abnormal, and this is where toxicity can play such a big role, because toxicity, if it's allowed to store in your body, can take whole areas of your spine and reverse them. So we can see the thoracic curve that's supposed to look like this reverse and go backwards. Well, that's going to have an impact on the nerves going to your heart, and over time on the actual function of your heart. So we can look at spinal x-rays, and even without taking a case history, have a very good idea of where a person is functionally having a lot of challenges based on how their spine is abnormal. Okay, and it has nothing to do with the bones. It has to do with the nerves that are wrapped inside of and coming out of those bones.
And I think that's probably the impact of this conversation today for those of you that understand a little bit about chiropractic care, and that you go get you feel like you're stiff, you're sore. So I'm gonna go get my bone cracked because I'm stiff and sore. There's such a difference between just the bone care. You are going into the place where this is what is flowing through that spine that those bones are holding and protecting, correct?
Correct. And stiffness is nothing more than inflammation building up in a part of the spine that doesn't move. So let's talk about today's life hack, because I want to leave everybody with a life hack. So one of the studies that I shared with Becky prior to this talk was a study on seated posture. Okay, your seated posture affects neurological volume and amplitude. And if you've never had a doctor tell you that, you got robbed, because we spend a lot of time seated. And when we're seated, we're under this thing called gravity. So there's always a certain amount of stress on our spinal systems. So if you're listening to this right now, I want you to envision your head, which is this bowling ball, on top of your neck, which is this much smaller structure. And then you have the foundation of your shoulders.
How much does your head weigh?
That's a great question for Google.
Google it and tell us tell us here on Facebook. So go ahead.
So here's what the studies have looked at, and the studies are using types of EEG. So we're looking at neurological amplitude and volume. This is how much signaling, how much electricity, this is a buzzword now, how electricity does everything, and it's not quite correct because you have to talk about the nervous system. If you're not talking about electricity and the nervous system together, you're missing the point. But the electricity that the body creates has to do with a functioning nervous system. So what they found in this study, they took asymptomatic healthy adults, and if the center of their ear was in line over the center of their shoulder versus 2 inches forward, allowing the head to come 2 inches forward so that there was a gap between the center of the ear and the shoulders, that made a change of 25% of neural function and amplitude and volume. So sit up straight, you have 25% more function than if you allow yourself to slump forward and the head to come forward. I mean, that is critical mass. That's a huge difference.
So think about that for children. Let's just talk about children. You're a mother of a gorgeous little daughter, and and we are in a iPad and iPhone era.
Correct.
And these kids are sitting down, or even they're just at their desks with their heads down writing, and at times at home all during the day with their heads forward, weighing their little heads on their little necks forward on their phones. I mean, I just think of that from a very young age.
Yep, super detrimental.
And how that's flowing into their growth years.
Correct.
In their neck and their spine.
Parents, you've got to get the tablets off the laps. You got to put them on a stand. You got to put them on a wall. We need to be looking straight across. And the people who created tablets and phones, they know this. Okay, my first practice was in San Francisco. I dealt with a lot of people in the Silicon District. It was amazing how differently they treated cell phones and tablets versus what we treat cell phones and tablets. There was never an idea that you were supposed to look down on them. That is super hard on your brain. It's super hard on your spine. And it is going to eventually cause the ligaments in the neck.
Instability.
Exactly.
Of course it would. That makes
Yes.
it just makes so much sense. So again, let's go back to just by straightening that up, and I'll tell you what, it feels different to I literally, if you're listening, I want you to literally straighten your shoulders, put your head chin back just a little bit, and put those ears over your, and like, well, that feels not normal. Well, that is
That's normal. That's biological normal. And it's biological normal for everyone. It's biological normal for a 5-year-old. It's biological normal for a 95-year-old. So take it a step farther. Go to your local nursing home this week. Go and watch and just look at the difference between the center of the ear and the center of the shoulders. And for me, I can barely be there because I go, man, we have a whole profession that if it was ever supported, ever given any opportunity to succeed, and it's not, okay, we could have chiropractors in every nursing home getting people's heads back over their shoulders, and you would see some of these neurodegenerative diseases dry up in 4 or 5 years. You'd literally see them dry up. We would walk into nursing homes and you wouldn't see people messing the beds anymore because their system would be allowed to function. We're not supposed to break down as we age. That's a total myth of pharmacology, that at some point in time you're just going to have heart disease. No, all of these systems in the body, every single one of them, outside of your fat. If you remove fat, it is not coming back. But almost every other system in the body has regeneration cycles built into it. And if your nervous system is working correctly, those tissues are going through repair and regeneration, and quite aggressively.
So when you say 25%, I mean, give a perspective of how that's a good volume of health.
Yeah.
I mean,
hugely.
imagine right now you have a migraine and it's off the charts and 25% relief came over your body immediately. You would be like, oh, that was relief. I mean, honestly, I think a 25% is, I don't take that lightly. I take that with a lot of gravity because a 25% improvement is huge.
It's huge. Well, and look at it from this context. For the FDA to pass a pharmaceutical drug, that drug only has to show a 12% improvement in the symptom.
I don't even like to hear that.
Only a 12%.
Oh, boy. Oy.
That's a very, very low bar.
Yes, it is. That's a
and
low
yet
bar.
We have studies showing that just altering your posture, I mean, and take this to another level. Think about if you actually are lucky enough to get a chiropractor that helps you restore your neck back to normal alignment. We don't even know. We've never run a pre and post EEG study on that. But if just changing head to shoulders gives you 25%, we're talking about hundreds or thousands of % improvement in function when you actually correct the neck alignment inside the spine. I mean, this is off the charts. We're into regenerative chiropractic. We're into realms of allowing the body to heal at an advanced rate by removing what was keeping it from healing in the first place.
So you have a quote over in your office that is. Can you quote it? The one
I have
on your
lots
wall?
of quotes on my office.
It's the one behind Lynn's desk that says about healing yourself. That the future, that the medicine.
Correct. So the future of doctors is no drugs, no surgery, but it's actually just looking at how the body heals itself.
Yes.
Yeah.
And physician heal thyself, body heal thyself. That's really, and anybody that knows me in the space that I'm in, I am into the body's ability, God's given ability in our bodies to heal and repair itself. And I think that's why I vibe so strongly with Dr. K and everything that she represents. And when I went in and found out that she'll and we're going to go at this last section that we have. I've had Bob said, tell her to tell some stories now about what's happening there, because you guys, the power of life is in the testimony, and that's what builds your faith in what we're talking about here. And I hope that your faith has already been built just by what you've been hearing of how important this is and the direction that needs to be, and I believe with all my heart, Dr. K, that this is a direction that America is going to be going in this body healing and repairing itself direction. I've been having that conversation for over 9.5 years with people that know me and know what I do. And Dr. K, you are rampantly bringing this story out, and bring back the chiropractor is what I'm cheering about, is all I want to say. And we're at the middle of the hour. We're almost done, and we're going to come back and we're going to share with you some absolutely heart enlightening stories that have come through Averio Health Institute. With that, we'll go on a break.
Hey, Dan here from BODY TEMP Automotive.
And I'll remember the hard. I'll try not to let you down on the hard stop later.
When I start playing the outro music, you have about 30 seconds.
For coming on the next one. Like on the last one?
When I play outro music, which is at the end of
The end of the show.
30 seconds.
Okay, that helps. That's good. Right when I hear it, watch the clock then.
Yeah,
All
so
right.
that will be 57:50 when you have to be completely off the air and I'm switching to commercials.
Okay, got it. Okay, guys, anything else? Anything coming up here? Oh, does she recommend a neck posture corrector brace, sitting brace?
Not outside of working with your chiropractor. Because if you use a traction device, and you need to be very, very careful to not use a traction device off of Amazon. Studies have been done that the leading traction device off of Amazon actually makes your neck curve worse, and it does so extremely quickly. Chiropractors have developed neck traction devices that work. CBP is a great place to go. Chiropractic biophysics, go look at their studies, go look at what they've built. But even their devices were designed to work in connection with chiropractic care. So if people are using a neck traction device, they need to be getting adjusted at least one time a week in the neck. Okay, you can't be getting adjusted down here. Getting adjusted down here is not going to affect the neck. You gotta get adjusted at least once in the neck, and then do not use that posture corrector more than 5 minutes a day. 5 minutes is the maximum that you want to use it for.
Okay, good. I hope that was helpful, Ellen. I'd love to thank you for reminding her of good posture. Okay, thanks, Karen. I knew somebody would do it.
11 pounds.
11 pounds. Holy moly. I mean, pick up 11 pounds in your hand and lift that, for a few times. You'll know how heavy that is. That's super heavy. Has this been good, you guys? You liking this? I'm going to ask the studio audience that too, but how are you thinking about this? I love it. It's not long enough for me. I want to just geek out with her for another 3 hours. All right, we are back. This is our last segment of the show, and I hope that you have been as absolutely enlightened and have got a few paradigm shifts. I think, Dr. K, that is something that I think that has happened to me in the most powerful way since meeting you and your team and going through Averio Health Institute now. I'm becoming one of your regulars, like big time. Everybody, as I'm coming in, oh, hi. I mean, when you go once a month for a whole entire day, you get to love and know your people that are there. And they are every single one of them just ooze with passion of what they are doing and knowing how many people they have touched, helped, and to help their bodies heal themselves. And so I hope that you are out there, are listening, are being encouraged. And at the end of the show, I don't want to forget that she can kind of help instruct you on what questions to ask a chiropractor. Let's hold that off towards the very, very end, because you gave her a little tip about posture earlier in the show, which is great because we needed to talk about that. And I wanted that to inspire you to stand up straighter and sit up straighter, and to get your children too as well. But I remember, Dr. K, and I tell the story to so many people, when I went to my first full week of care, there was a little young boy, and he was 6 or 7 years old, and he had cerebral palsy. Mm-hmm. And he was, his little arm was, kind of curled up, and you could tell he was kind of dragging one leg. Sweetest little Amish boy. By the way, the Amish community has found the Averio Health Institute. So if you go there at any given week or day, week of care, it's filled. They train themselves out, entire families at a time, and they come from almost every state.
We have 25 Amish communities in 25 states that are coming out right now.
All the time.
All the time.
All the time. And I have met the most lovely people, and some of the people that I know in my business and my team are Amish, and I just love hearing from them and interacting with them. But this little boy came in, and when he first walked in the door, because now you have a children's separate children's one, which is we need a whole nother show about that. But I have to tell a story quick, and then you're going to tell more stories. So I watched with my own eyes this little boy come in, getting adjusted multiple times a day, going through these laser treatments that are activating his cells and his body to regenerate. And then you would have a march up and down this long hallway that you have in your upstairs and in between all the rooms. From Monday, when he first started walking, and he's kind of pulling his little leg and walking up and down. By the time Friday came, and I could just almost cry. I cry almost every time I tell this. His arm was freely swinging by his side, and his little legs were just marching. Mm-hmm. Sorry. It was so powerful for me to experience and watch a little boy that was kind of curled up and stiffened up, literally marching, and his smile was ear to ear as he's marching up and down the hallway, and everybody's marveling. Look at the progress that little boy made in a week, mm-hmm. in his ability to communicate with his body and how it moved up and down the hallway. So that's just my personal experience of watching a child, I don't even remember how old he was between 6 and 7, be transformed mm-hmm. through cervical care, Dr. K. Hello. Now, please tell us a couple other significant. That's just one. And you've shared many in your lectures there, and now you've digitized your lectures, which you need to multiply yourself. So although I appreciate you standing there wagging your finger at us live, I can still hear it in your voice because I know you so well now. I can still hear it in your voice when I hear your digitized ones out. But we're still being trained just as equally. So, and you share a lot of testimonies and stories. We're not disclosing names. We're not disclosing mm-hmm. anything personal, but we're telling stories that are absolutely life-changing.
Absolutely. And we have actually taken a fair amount of these studies and published them internationally. We have a working relationship with the Australian Spinal Research Foundation, and our small facility in Mount Vernon, Washington, has internationally published 14 case studies
Wow.
of reversing things, and I tend to be a little bit of a spicy potato, so the cases that I choose to submit for publication are typically cases that you would not even put chiropractic next to that particular diagnosis. And please realize we are working with their medical teams. We are not diagnosing people with these issues. We are not undiagnosing them. We're doing the heavy lifting of changing how their body gets to regulate and function, then sending them back to their neurologist or their medical doctor to make the differential on that and go, oh, well, yeah, you don't have Parkinson's disease anymore. Oh, yeah, you really don't have cerebral palsy anymore. We let the medical side handle that. We're well within our scope of law. But when we talk about how exciting things can change and how quickly, 2 weeks ago, we had an 88-year-old gentleman who had been medically diagnosed with Parkinson's disease, and he could barely move around the facility with his walker, and his neck was probably close to 6 inches away from where it should be.
Wow.
I mean, we're talking super bad. You can start to have damage at millimeters. This gentleman was inches away from normal. And what you need to understand about a neck that is that far away from normal, we're talking about it coming forward, so the chin has come forward of the chest. Well, there are 2 nerves that run in front of the spine that are really, really important. And they are called your vagus nerves. They run on the right and the left side of C1. So let's look at Parkinson's really quickly. Parkinson's disease is unique among the neurodegenerative diseases because there is good evidence that there are tau proteins, these inflammatory proteins that come out of the diet, that retroactively creep from the gut up the vagus nerves into the brain, and that is what is causing Parkinson's disease.
Wow.
So you've got people who go, we'll cut the vagus nerves. You have people who go, we'll change the gut. We'll try to kill the tau proteins. We'll make dietary modifications. And then you have someone like me who's looked at thousands, if not tens of thousands of x-rays and understands that the alignment of C1 actually determines how well those vagus nerves get to function. And I look at a Parkinson's disease case and go, can we return normal anatomical integrity to that upper cervical complex? Can we bring C1 back into normal alignment, taking the abnormal stress and inflammation and irritation off of C1? So that's what we did in this gentleman's case. So I have a pre and post x-ray taken within 1 week of concentrated care, and he went from about 5.5, 6 inches away from normal to 1 inch away from normal.
My goodness.
So do you think he needed the walker to go home with?
Wow, so tell us. Do tell.
He showed up to the office Thursday morning. We're not even through the entire week. Thursday morning, he showed up standing straight, walking without assistance. It was the first time in over a decade he'd been able to move without shaking and without weakness and without a walker. And this is why the Amish are coming in floods, because they only need to see that happen once.
Yeah.
They
So
see
this- oh my
they
goodness.
see something like that happen, and then we get 50 calls in 24 hours, which is, and we're doing everything we can to increase the availability. So if you're sitting here with chronic health issues and you go, there's nothing for me to do, that is wrong. We can get you started. We can get you the right type of tests. We can get you some protocols at home to get you started, moving in the right direction, get you getting on that path even before you get through your week of care, in case you have to wait a while for that. There are things to do.
So talk quickly about a day of care, and we got not too much time. Oh my goodness! Quickly,
Very quickly.
a day of care.
A day of care. It's kind of
and know that a day of care is multiplied into a week of care. So day of care. What is that? What will that entail?
A day of care means a patient comes out. They go through neurological and spinal hygiene exercises in the morning. We teach you a couple of things from the science. And then there are 6 hours of concentrated chiropractic care. You receive multiple adjustments. You receive photobiomodulation treatments, nutritional therapy, hot, cold, active, passive, everything that you need to move in the right direction for your body. It's very customized to you. And most people are coming for a day of care for a very specific purpose, which is to provoke, to do a urine analysis for toxicity. And right now we have people flying in from all over the place just to stay on site for a day to get that assessment done. Because in a lot of times when we can figure out what's damaged and what toxins are in your system, we can start to put a protocol together. You may do that protocol for 6 or 9 months before you actually come for the concentrated chiropractic or the week-long programs to get your spine back into normal. There is a frequency here that matters. Mm-hmm. There are no studies that have shown that you can change spinal alignment with one adjustment a week. Mm-hmm. One adjustment a week is maintenance care. Mm-hmm. And chiropractors have lost themselves, and medical doctors have lost themselves, and we're not telling the public the truth anymore because we think that all they will commit to is the minimum care. Mm-hmm. So chiropractors have just gone, well, you know, I'm barely getting paid by insurance, and this is the minimum care they'll commit to. That never worked for me. We're results driven. And if you want to get results, especially in a complicated case, you have to provide frequency. Some of our cases didn't break open until the person got 200 adjustments. Mm-hmm. And some people fall out of their chair. Chiropractors fall out of their chair. Yeah. 200 adjustments. You're over treating people. No, we're not. Mm-hmm. Okay, if it was based off of symptoms, maybe you could make that argument. But we're objectively looking at how their spines change, how their urine analysis change, how their segmental body change. This affects wave amplitude, something that literature says isn't even fixable. We are seeing it change after 5 days of concentrated care in over 90% of the population. We're going to run a 12-month study on it, and we're going to publish it in a major medical journal and go, we are missing the boat here, guys.
Cue in the music. We're done. Oh, you guys, you see why I clamor for more. I could just listen. She leaves us hanging for more. You guys, thank you so much for listening today and being here with us. Averio Health Institute. And we didn't even finish all the conversation, but maybe I'll finish some with her and then I'll post it in the comments on my Facebook. But God bless you all. And it's a wrap. Bye. Okay, you did good. All right. Oh gosh, okay, you guys, it's just so good. So what kind of therapy does she provide, and is it just in Washington? Well,
right now it is.
Right now it is. And Kim, listen to the rest of the show, but I can talk with you personally because I know you. So if we want to have a conversation about it, and so what we want to also let you know is how do you find a chiropractor.
Oh, so, yeah, we didn't get into that.
Yeah, so
we can record that now.
Yeah, we'll record that and I'll post that and let you know. All right, guys. Love y'all. See you again.